This is breaking news.
Right now, New Jersey Governor Phil Murphy is making an announcement on his efforts to combat the opioid epidemic. Let's go to it now.
There is a war of choice going on, led by the Putin thug, lying, savage regime. And New Jersey will stand in spirit, action, prayer, and any other way we can with our Ukrainian brothers and sisters. We have among the largest Ukrainian populations of any American state. We have just about 75,000 only. New York, California, and a little bit more in Pennsylvania. The Ukrainian Orthodox Church, other than Canada, its global headquarters outside of Ukraine is located in Somerset County, New Jersey. And I know Vince and Claire saw the other day with me the Metropolitan Antony, who is the head of that church for everywhere outside of Ukraine and Canada, gave our invocation at the budget address earlier this week. This is an unspeakable tragedy. We're doing everything we can. Obviously, there's only so much a state can do, but if you are interested in participating and understanding what we are doing, please go to nj.gov/Ukraine, nj.gov/Ukraine. You'll see at a minimum, you will see a list of websites and places you can go to donate, whether it's money, clothing, armored vests, I think the whole range of items. And we will stand in solidarity, as I say, in spirit, in prayer, and in action. So God bless everyone there. I want to recognize, obviously I've got an august group with me at the table, but before I go through that group, I see Sarah Edelman is with us, our acting Commissioner of the Department of Human Services. Sarah, great to have you. Is that you, Christine, behind the mask? I apologize. The Commissioner of the Department of Children and Families, Christine Norbert-Beyer, is also with us. I also want to acknowledge Assemblywoman Claire Swift is with us besides Sarah and Christine. I mentioned Commissioner Karen Fitzpatrick. Ernie, is that you? Were you sitting there when I just asked Karen? Okay. Okay. Atlantic County Commissioners Karen Fitzpatrick and Ernie Corsi are with us. Great to have you both, and to other folks who are teammates at Behavioral Crossroads or other dignitaries, it's an honor to be here with you all. So I'm joined up at this table by the guy to my right, who's the Acting Attorney General and a great leader, Matt Plotkin. We'll hear from Matt in a few moments. Matt, great to be with you. To your right, I guess, we've got Assistant Commissioner of the Division of Mental Health and Addiction Services, Valerie Mielke. Valerie, it's great to have you with us as well. We have on the far left, Priscilla Robinson is Director of the Not One More campaign. Yeah. Caitlin O'Neill to my left from the New Jersey Harm Reduction Coalition. Great to be back with you, Caitlin. We also have to Matt's right, Tricia Haynes, a counselor right here at Behavioral Crossroads Recovery. Great to have you. The opioid epidemic knows no bounds, and it certainly does not care what political party you're in. So in that respect, I'm incredibly honored to be joined by representatives, outstanding representatives, I have to say, from the Republican Party. Senator Vince Palestina to my far right. Vince, great to be with you. I mentioned Assemblywoman Claire Swift. Claire, thank you. And to my left, a guy who I normally only speak to in stormy weather, Egg Harbor Township, Mayor Paul Hodson. And Paul, thank you for hosting us in this great community. I believe the largest population community in Atlantic County, am I right? I think so, right? So it's an honor to be here. And this is a sober topic today, but it's one that there's enormous not only passion, but enormous amounts of resources putting up against this crisis before us. So on Tuesday, as I mentioned, and Vince and Claire were there, I presented, as was Matt, and our fellow cabinet members, I presented a state budget that would maintain our data-driven investment to address the substance use crisis and the overdose epidemic. Importantly, we're investing in the critical mission and work of harm reduction centers treatment programs, just like behavioral crossroads, I might add, among so much more. A vital part of this investment will be our state's share coming in over the next 18 years of the more than $640 million from the multi-state settlement with opioid manufacturers and distributors. Their profits will now go, as they should, to helping rebuild the lives that have been destroyed. These funds will be split 50-50 between the state on the one hand and impacted municipalities on the other hand. And together we're going to maximize every dollar. Now, one of the caveats of this significant amount of resources is that it cannot be used, nor should it be used, nor would we ever do this, to replace state dollars that we're already applying to this crisis. So in every case, these are plus-ups to all the programs that we're currently investing in. And I mentioned in the budget that's nearly $100 million on the state side. This will be added to that, as it should. Now, it's not the only settlement. I suspect Matt may refer to this. Through his offices, we are proposing to put $13 million from a separate opioid marketing settlement to use in expanding harm reduction services and supporting existing and new programs that help with the screening for substance abuse disorders and connecting people excuse me, to treatment. And I think $9 million of this $13 million is already, a request is already with the legislature's Joint Budget Oversight Committee, and we look forward to swift approval. And again, Matt will likely provide more. Now, in 2021, the overdose epidemic claimed 3,081 blessed New Jersey lives. That's an average, by the way, of more than 8 lost lives a day. Compared to 2020, it's an increase of about 30 deaths and about 86 more than we saw in 2019. Now, we in New Jersey did not see an acceleration of deaths during the pandemic at the rate that many other states experienced. We are hopeful that this is due to the strong foundation that we have all collectively been building together over the past number of years and will continue to build upon. If you will, the past several years, the curve has flattened. But when you've lost 3,081 lives, that's 3,081 lives too many. Let there be no doubt about it. We have to stay at this. I mentioned in the opioid, the COVID pandemic, that we cannot realistically manage it to zero. It's an endemic that's going to be with us like the flu is with us. I think all of us, as it relates to the opioid pandemic, are committed to doing everything we can to drive that number to zero. Last Friday, by the way, speaking of the COVID pandemic, officially, it's been 2 years since that pandemic has visited New Jersey. And we've entered every day aware not only of the need to fight COVID, but of the need to prevent increases in substance abuse and overdose deaths, and to renew the commitments across agencies, providers, and communities to prevent disruption in vital services. And we know the pandemic has only added to mental health challenges, stress, anxiety, loneliness in society. I want to specifically acknowledge Sarah, Valerie, Judy Persicelli, who's not with us, our Commissioner of the Department of Health, Christine, and everyone on their teams for working to keep harm reduction and treatment and recovery supports accessible throughout the pandemic. Fighting COVID highlighted the value of harm reduction, which is one of the key approaches we take in this space. Harm reduction practices meet people where they are, and because of their clear evidence-based impact, we know they reduce disease and save lives. We remain committed to working across departments with service providers and alongside our legislative, county, and municipal partners. We recognize that criminal prosecution of those suffering from addiction and returning to the failed war on drugs will not solve this problem. Every time I clear my throat, my back is. Instead, we must ensure that people have access to treatment and compassionate care. Finally, I acknowledge the commitment of everyone here today, including the work of the guy to my right, the Acting Attorney General, and his dedicated team for leading the legal fight and securing these resources for the people of our state. And most importantly, solemnly, I honor and remember the lives lost to this devastating crisis. As I said, we will not give up this fight, and we will not give up hope, and we won't give up on the residents who need our compassion the most. Again, thank you for hosting us so graciously this morning. And with that, I'm going to go around and ask folks a few questions. But before we do, I'd like to turn things over to the Acting Attorney General, Matt Placken, for a few words. Matt.
Thank you, Governor. And good morning, everyone. It's great to be here. I want to first thank the Governor not only for organizing this important event, but for your tireless commitment, as well as your administration's tireless commitment to combating the opioid epidemic, which we all know has harmed far too many New Jerseyans over the past decades. This is a truly historic moment in that fight. I want to thank and acknowledge all the panelists that are here, legislators, my fellow members of the administration, mayors, as well as, importantly, the people who are doing the hard work every day to provide relief to people who are suffering from addiction. And as well as to my colleagues from the Department of Public Safety, Chief Counsel Matt Burns, and others who have spent years litigating these important cases. As we know, and as I mentioned, the opioid crisis has devastated the lives of far too many New Jersey residents. No corner of our state has gone untouched, but today, it's great to announce that we're turning a new page. For years, our office has been pursuing lawsuits and settlement negotiations to hold drug companies accountable for the role they played in fueling the opioid epidemic by falsely downplaying the risks of opioids and by failing to prevent illicit sales. Now, those efforts are quite literally paying off. The state, and this is important, the state, all 21 counties, and hundreds of New Jersey municipalities have joined together to enter into nationwide settlements with 4 of the companies that share the responsibility for fueling this crisis. The drug manufacturer, Johnson & Johnson, as well as 3 drug distributors, McKesson, Cardinal Health, and AmerisourceBergen. Because our state, counties, and municipalities were able to work together to resolve these lawsuits, New Jersey and our communities will be receiving the maximum amount of money that we were eligible to receive under these awards. This is a truly big deal and something not every state will be able to say. That amount includes $641 million that will be spent almost entirely for treatment and recovery, prevention, and other strategies like supporting first responders and funding research to combat the opioid epidemic in years to come. And Governor, you mentioned some of the money that's already being put out through other settlements. Just to give you a flavor of how real these programs are, through that money, we'll be able to establish drug court programs at municipal level, which don't currently exist. With partnership with the Department of Children and Families, we'll be able to train law enforcement to identify signs of trauma in youth who are dealing with parents who are suffering from addiction and provide them the resources and services that we do provide throughout the state. The money will truly be put to good use. I look forward to working with the Department of Human Services, as well as other agencies, experts, and stakeholders to ensure that these funds are targeted where they are most useful. And I also look forward to these funds and funds from other settlements being used for critical programs like supporting treatment and rehabilitation, and importantly, not incarceration for low-level offenders affected by addiction, and supporting services for children and their family members who are dealing with substance abuse disorders. As part of these settlements, our office agreed with counties and municipalities that most of the funds will be divided 50-50 between state and local governments. This means that the money will reach communities directly where it is most needed. We've also agreed, and the Governor mentioned this, that these funds will not supplant existing funding streams. Instead, we will use these funds to expand programs that are working and create new programs to address the opioid epidemic at the county, state, and local levels. I know people have been concerned that these funds will be used in the same way that tobacco settlement funds were used in the 1990s, that state and local governments will use them to plug budget holes. I'm here today to tell you, thanks to the work we've done and the settlements we're entering into, that will not happen. This money will be used to save lives through treatment, prevention and other strategies. And I must say, Governor, thanks to your leadership, we don't even have the budget holes to fill anymore that might have otherwise been there. As acting Attorney General, I am beyond proud of our collective progress and honored to work alongside the governor, his administration, cabinet members, legislators, county and local government leaders, addiction specialists, and individuals working tirelessly in the treatment space to ensure that New Jersey residents receive the services and opportunities that they deserve. When I had the great fortune of being nominated by the governor, I stated that my highest priority was keeping New Jerseyans safe. These settlements reflect the power that we have when we hold those accountable who abuse their power, and when we prioritize the well-being and health of all of our residents. I thank the governor, I thank everyone here for having me, and this is truly a momentous day in our fight against the opioid epidemic.
Thank you, Matt. Well said. And by the way, you and the team have picked up the fight that has been waged over the years, including by your predecessors, Chris Perino in the Christie administration, if not before, Gabir Graywal, Andrew Bruck in our administration, and now you and your teammates who are here deserve an enormous amount of thanks for that.
Absolutely.
So deep appreciation. Tricia, let's start with you. Do you mind maybe give us a little bit of insight as to your own story? What supports have been the most important for you? And if you were king for a day and you had control over this money, where would you like to see the priority spent? And again, great to be with you. And again, Trisha's here as a behavioral crosswords recovery counselor.
Good morning. How are you? So I used for many years, and opioids is a big part of my story. And I was a client here at Behavioral Crossroads, and it was here that I decided that I wanted to help people and become a counselor. I learned how to work on my behaviors. I learned how to mend relationships. When I came here, I didn't have anything. I lost everything. I hadn't spoken to my children or my family in 6 years. I came here through drug court, and my biggest support systems were drug court, Behavioral Crossroads, and 12-step fellowships, sponsorship, home group, meetings, and I rebuilt my life again. And with this money, I think the most important issues are to reach teens and young adults and educate educators on the signs of use through their curriculums on relapse prevention, coping skills, and mental health awareness, and making sure these students have been properly evaluated on co-occurring disorders. Also making sure the families are aware of and involved in what's going on with their children.
Counselor here.
I've been a counselor here for 1.5 years, and I have 4 years clean.
God bless you. Is a question, are some of the counselors here also former clients?
Some of them are, and some of them aren't. Also, it's really important that you know that my family did come back into my life. And my daughter, she came here and spoke to the clients about what it's like to have parents in addiction, and it was amazing.
Wow.
Yeah.
How old are your kids?
18 and 13.
God bless them.
Yeah.
Which one is the daughter that spoke?
My 18-year-old. She's back in my life. The other one isn't ready yet, but she'll come back as long as I keep doing what I'm doing.
Wow. Let's hear it one more time for Tricia. Incredible.
Thank you so much for having me.
Come on, are you kidding me? It's our honor. Let's stay on this side of the table, Valerie. We're sharing. I apologize. We should have sprung for some more mics. I apologize. As you can see, we've spared no expense here. We've got a bullhorn next time. Valerie, again, is the Department of Human Services Assistant Commissioner. Great to be with you again. I know you and your colleagues across the administration work hard to break down barriers to accessing treatment. Give us a little bit of sense of what steps you take, especially I'm thinking of, which was a huge sort of bridge to cross in our early days in our administration, medication-assisted treatment, or so-called MAT. And the other piece, Valerie, is we know racial disparities exist everywhere, and this is no exception. A little bit more color, and that includes not just folks who are addicted, but sadly, folks who are passing. Can you share a little bit about how the Department of Human Services is going about addressing some of these disparities